Now, suffering from some kind of pain, listen up. The comprehensive pain specialist can help. They evaluate each patient and take an overall wellness approach. Dr. Benjamin Camoranci is joining us now with more. You and I were talking a minute, and I have pain a lot of times in my knees from running a lot in years early, and also from jumping out of perfectly good planes for about 33 years. Tell us about the different pains of individuals with different pains that come into your office.
Well, a comprehensive pain specialist, we treat a variety of chronic pain injuries. The majority of our patients suffer from neck and arm pain, low back and leg pain, but we also specialize in treating joint pains, knee pains as you mentioned, but also certain pains associated with specific disease states, such as the burning diabetic neuropathy pain that diabetic patients so frequently encounter, as well as breakthrough pain that cancer patients suffer from. And more recently, we've begun to treat the pain that goes along with migraine headaches, finding that simple procedures are able to decrease the intensity, the frequency, and the duration of those headache pains.
And what is the treatment for that? I mean, because I can imagine it must vary from minor to major, working on that one particular patient that has excruciating migraine headaches all the time.
That's very much the case.
Yeah.
And what we do is, it sounds daunting at the onset, but it really is a simple process. And it all starts with coming in, sitting down, and having a detailed discussion about your particular pain complaints, as well as your previous pain history and certain therapies that may have been used, tried, or failed in the past.
Sure. Talk to us about intervention pain management, exactly what that is.
Well, interventional pain management is the use of targeted injections to help treat the underlying pain at its source. And again, it all starts with affecting an accurate diagnosis as to what the underlying pain is related to. Once that's been established, we can, in the instance of knee pain, we're able to replace some of the tissue and the jelly-like substance that's worn out of those joints over time. So a simple injection gives relatively long-lasting relief by being able to once again cushion those joints.
Yeah, because you and I were talking in the break right before we came on. I said, on my right knee, I've got a lot of bone-to-bone, and because you can actually hear it when I'm rotating, and that bone-to-bone that's there, even though I still try to work out every day, get on the treadmill or on stationary bike or whatever, and you're talking about a painless little injection just below the kneecap where you freeze it and it puts gel in there, and I got to come and see you, man. That's all.
Happy to have you.
Yeah. Now, you used to be right outside of Savannah, but you felt that it's best, as a number of doctors are doing these days, is to specialize in one area, because there's so many ailments that are going on with us because we're so very active. We sometimes abuse ourselves physically, either through sports or just exercise, and we've got all these pains that are there, and especially as we get a little bit older, some of those pains are creeping up on us pretty quick. But you're now specializing in the management of pain itself.
That's right. Pain management is basically an offshoot of anesthesiology. So those of us trained in the specialty also have a component for practice related to chronic pain management. And about a year and a half ago, I decided to do this full-time outside of the hospital, and we're happy to establish our first office right here in Mount Pleasant at Ivy Hall.
At Ivy Hall, just up Highway 17. Tell us
right.
about what a patient can expect so far as defining success and your goals and their goals with the patient.
Typically two different things. Our goals are to reduce patients' pain by at least 50%. That's our target. But individually, patients come to us as stating different goals. Some people want to get up in the morning after having a restful, refreshing night's sleep, tackle their daily activities. Sometimes we have grandparents that come in and they want to get down on the floor and be able to play with their grandchild.
Sure.
Other patients can't wait to get back out and walk on the beach or take a jog on the beach. And there's a subset of patients who can't wait to get out and enjoy certain hobbies that they haven't been able to engage in for years.
Doctor, a pleasure to talk with you. Now, tell us exactly where your office is again.
Our office is at the entrance of Ivy Hall, north on 17, just outside of Mount Pleasant.
Doctor, thank you for joining us.
Thank you.
Thank
Happy
you
birthday.
for moving up from. Thank you for moving up from Savannah. That's for sure. Next, our Senior Week continues. Learn more about senior daycares. Stay with us.